The School of Dentistry at the University of Minnesota is located in the heart of the Twin Cities. This is our beautiful Moose Tower. Welcome. So a lot of students always wonder what a dental journey is going to feel like, and I'm going to take you on what my dental journey was like. So first year, you take a class. It's called Oral Anatomy. It's one of the first classes that you take. So once you make it through that class, you're pretty much golden. In first year, there's some other classes that you take too before you work on an actual tooth. You'll learn the old school way, which is hard, but you need to know the fundamentals. So we're gonna go into the pre-clinic right now. And this is where the first and second years basically live, breathe, eat, sleep. I'm kidding, you can't eat in here. So Abby here, she's a second year dental student, and right now she's working on making a crown for a tooth. And as you can see, she has all the tools necessary that she needs. She has her high speed and low speed hand pieces. You get all these different cassettes here as if you're working on a real patient. I was personally in lab all the time, and there's extra hours outside of class that you can go in and practice if you need to before you actually go up and you graduate from pre-clinic. And once you graduate from pre-clinic, it's a very exciting time. That's when you can start seeing patients. So all the third and fourth year dental students, this is one of the floors that they can work. So this is my friend Becca. She's going to show you guys what the PPE looks like and how you're supposed to dress when you're in clinic and you're trying to see a patient.
First thing, wash your hands. Make sure they're nice and dry. And then, first thing we have the N95 mask. So over the N95 we wear the surgical mask. Make sure you pinch the nose. And then I'll put on the safety glasses.
And then she's going to put on the face shield. We're going to put on this wonderful shower cap. And then last but not least, she's going to put on the gown.
And then we have the gloves. And there we go.
Beautiful. So before we get started with anything, we always need a start check. And so we have a faculty come in, the faculty says, yep, you're ready to go, you know your plan, go for it. Or sometimes if you have a question, you just flip that light on and then the faculty just comes in. The nice thing about that is you don't have to leave your cube, you just stay there and then the faculty comes.
The student will present the patient's health history, their treatment plan, what she proposes to do today. And then if everything looks good, I will give a start check in the computer with my card, which will approve the work that's going to be done that day. And then we have checkpoints at various times during the procedure as well. And a final check at the end.
Hi, Al. So everything that we get comes from clean dispensing and it's sterilized. And once you're done with everything that you have used that day, you put it on a tray and you take it to dirty dispensing and they clean it for you. Don't forget to say thank you because they do a lot of work for us. One of the really good things about University of Minnesota is we have a ton of specialties. So if you're interested in something, there's definitely going to be a specialty here for you that you can learn from. So the University of Minnesota School of Dentistry actually has a robust research program and we get more than $7 million annually. So if research is something that you're interested in, University of Minnesota is the right school for you because we have a lot of clinicians that are known internationally and nationally for the amazing research that they've done. This is actually the artificial mouth and this was created in University of Minnesota and it's really cool. Once you're a fourth year, you go on something called outreach. So we actually go to other areas in Minnesota where they have underserved populations, and that's when you start building your skills to become a dentist. When you're not in class or clinic, there are many places to hang out and study together on your own. So we have the 9th floor reading room that you can go and study in. There's the library, of course. We have a new building, which is called the HESC, outdoor spaces, Caribou Coffee right here in Moose, and you have the dental fraternities. If you want to get involved in school, there's tons of different ways that you can do that. There's different clubs and organizations that you can be a part of. That's a kind of the community feel that you have here, and that was really important to me. I wanted to feel like I was a part of a community. The sense of competition isn't really here. No one's trying to outdo another person. They're just trying to help you so that everybody can graduate from the University of Minnesota and have kind of that label on there and that we're all really good dentists.